Hello, today I have the enormous honor of introducing you to my mentor, my number one mentor, Dr. Paul Epstein. I really credit Dr. Epstein with getting me into mind-body medicine and really showing me that this is actually the be-all and end-all of healing. And so every time I give a talk or anything, it's always dedicated to Dr. Epstein. So I am beyond honored to have you interviewing with us today.
Well, it's great to be here. And after that introduction, I don't think I need to say another word because it might be all downhill from there. But I'm humbled by that, knowing how special you are, how loving you are, how deep you are as a healer, how much you care about the healing process for your patients and self-care and for yourself. And I'm honored to be part of this particular summit and this particular topic because it's very dear to my heart, and I think it is at the core of supporting people to heal and to get well. So thank you for inviting me, and thank you for those kind words.
Yeah.
I really appreciate it.
Every single one is heartfelt. Well, I know a decent amount about your background and how you kind of came to be, and I really feel like that's an important part of the self-care of medicine piece, as you teach it to your participants and be with it with your patients. So I'm wondering if you can tell those people who are listening with us who maybe don't know you so well, a little bit about how did you become a naturopathic doctor, and how did you, before anybody else was doing it, how did you start integrating mindfulness and meditation as part of healing?
Yeah, that's an interesting question, and it's one that's now at the heart of my practice with clients, is to ask, tell me your story. How'd you come to be this way? To have a deeper appreciation of where we came from. Like, if you don't know your history, you're doomed to repeat it. But we need to know it to heal it, to change it, in a sense. So I'm honored to be able to tell you about how I became a naturopath, because I didn't grow up going, I want to be a doctor or I want to be a naturopath. And I think it just happens that we're speaking a week before Memorial Day. And so I'm going to talk personally, professionally a little bit. It'll give you a good foundation for my perspective and where I'm coming from. And I'll talk about my dad, long story short, briefly. He was a soldier in World War II. If you saw the movie Saving Private Ryan, he was on one of those boats to storm the beaches of Normandy. Clearly and luckily, he survived. I was born after the war. But he suffered from post-traumatic stress, which they didn't know exactly what that was. So I grew up, and now we know epigenetically, you kind of, as a child of trauma from your parents and what they went through, it actually gets passed on epigenetically, not just through your birth, but afterwards by their stress, their trauma, flashbacks, nightmares, anxieties, a whole host of mental, emotional issues and difficulties that my dad went through, that I went through with him.
So just by being exposed as like the children living in that house, that
Exactly.
could be passed on to us. Is that what the genetics kind of?
Yes.
Okay.
I.e., if you came from an alcoholic home and you're an adult child and an alcoholic. I had a center for mind-body medicine in Israel. Worked a lot with people who were children of Holocaust survivors. And the studies are showing that one could suffer from post-traumatic stress that you didn't go through, but your loved one went through.
Wow.
That we're affected psychosocially. Just like from a mind-body, just to divert for a second, we now know that the brain is plastic. It changes. That wasn't known 30 years ago. We now know that the brain and the immune system are connected. So when you're under stress, it affects your immune system. The good news and the exciting news about self-care as medicine, the topic of this summit, is that the evidence is overwhelming that when you take care of yourself, when you eat healthy, when you heal your wounds and your stresses and your traumas, you change your brain, you change your immune system, you change your digestion, you change your genetic expression at the cellular level. As a meditation teacher, when people close their eyes for 5 minutes, we can explain and measure the changes happening in all the systems of the body towards healing. So back to my story of how I came to be this way, is my dad, in suffering from post-traumatic stress disorder in the way that I shared with you, and the trauma of war, and them not know how to treating it, one of the issues he developed was heart disease. From the stress, the tension, smoking cigarettes, anxiety all the time, etc. And I grew up with that. And then my dad, long story short, with heart disease, died on the operating table having emergency bypass surgery. And all of a sudden, my dad's gone. And I had to go to the hospital. We have to operate. He's not going to survive. He had a heart attack. We need to do a bypass, etc. His heart was damaged. I had to give blood. He was 57. He didn't survive. And it broke me open. I was in my early 20s at the time. And all of the pain of his life that I hadn't dealt with, really, his traumas, we didn't talk about it. People didn't talk about those things in those days. He didn't talk about his feelings. I never asked him to tell me your story, Dad. Tell me about the war. I saw his medals. We saw his letters to my mom in Normandy, right, etc. We never asked, what happened, Dad? Tell me the story. We knew it, but just like I have patients who grow up in alcoholic homes, but nobody talks about it. You know, like you just survive it. And we survived it. So anyway, it broke me open, and I was in a lot of pain. I just was just like, wow, what is this? It was like a lifetime of his pain and my pain. And I got into yoga. I was seeking out, who am I? What's my life about? I was a Montessori teacher at the time, early childhood education, right? And I learned all learning is natural, and it comes through the senses. And so it was natural to then understand that all healing is natural, and it comes from within the person. It's part of who we are. Our body heals itself. It's the most natural thing in the world. You cut your finger, if you don't have a disorder, it will find a way to heal it. If you have a wound, the body-mind finds a way to heal it. If you lose a loved one, if you grieve, the body-mind will find a way to heal it. So I had a lot of self-healing to do from those wounds and my own struggles. And I embarked on my own journey of self-healing, not to become a naturopath. And in the process, I learned yoga. I practiced yoga, not just the body, asanas, the breathing, the meditation, the philosophy, the diet, the lifestyle. I lived in a yoga community. It changed my life. And I healed myself. I didn't have any physical ailments that I was treating. It was more the mental, emotional stresses and traumas of, you know, who am I? Like, how did I come to be? Why am I in so much pain? Who was my father? What I just told you about him, I didn't know until after he died. And I asked my mom about my dad. It was like, we didn't talk about it. In the process of being a yogi, and I became a yoga and meditation teacher in the 70s. And in those days, there weren't any naturopaths or chiropractors or functional medicine or integrative medicine or holistic medicine or any kind of medicine. And people came to yoga looking to heal themselves in the same way. And I'm a yoga teacher, teaching them the 5 points: proper diet, proper exercise, proper breathing, proper meditation, and positive attitude and positive thinking. That was the 5 points of Shivananda yoga. I still teach in the Bahamas occasionally, and there are centers all over the world. And I'm watching these people heal themselves. I'm not prescribing anything except teaching them yoga, how to breathe. In fact, it was better that I wasn't trying to treat their asthma and their arthritis and their anxieties. And I was just teaching them yoga. And I was like amazed. People would get well, slowly but surely, over time, changing their lifestyle, changing their attitudes, changing their perspective, seeing things with new eyes. I would later learn from Einstein, you can't solve a problem with the same consciousness that created it. And what I saw with people practicing yoga is their consciousness changed. Then, as you know, I went to naturopathic school, which was great. Learn naturopathic philosophy, treat the whole person, treat the cause, doctor as teacher, healing from within. And they were teaching me nutrition and diet and herbs and homeopathic medicine, Chinese medicine, physical medicine, all of that, which was great. But I wasn't interested in it. I was interested in the consciousness. I was interested in how to engage the patient consciously and actively in their own healing, because from my yoga background, I knew my work was to help people find their truth and their healing within them, not for me to prescribe things for them, as wonderful as our medicines are. And this is also part of naturopathic medicine, but I sought out to do that without medicines, without herbs. He was saying that your practice, as you've gotten more into, quote, mind, body, and consciousness and counseling, you find the need for prescribing supplements, as wonderful as they are, but they're in addition to lifestyle, in addition to consciousness. So I did a whole program at NCNM at the time, National College Naturopathic. Now it's NUNM in Portland, called Health Styles. It was obvious to me that it was lifestyle, that You had to help people change. Joseph Califano, head of HEW in the Carter administration, commissioned a report on healthy people, disease promotion, prevention, and health promotion. They found in 1976, this is what, 24, almost 40 years later, 45 years later, the chief causes of death were heart disease, cancer, and diabetes. And the chief cause of them were lifestyle, diet, exercise, and stress. And moving forward, it's the same thing. In our culture, we're dying from heart disease, cancer, and stress, among other things. Okay, now we know more about the microbiome, and now we know more about the mind and neuroplasticity, but it's the same principle. So I want to just tell you two cases that will illustrate this and go a little bit deeper into these questions. The first, tell me your story. So I had this health styles program, and I was the director of it. And people would come in the clinic, whatever their symptoms, disease, we'd engage them in lifestyle, diet, exercise, stress, in addition to naturopathic treatment and support, and we had a whole team. And I would walk around the track with a patient, and I would do counseling with them. I started learning a lot of counseling at the time, whatever the form was, but recognizing I had to also work with people's psychology. So I started training in guided imagery and Gestalt therapy and started learning psychotherapies, as you and I have now have studied internal family systems, integrating that into our work. And I had one particular patient who was obese, a little overweight. He had high blood pressure. He was pre-diabetic, which is, metabolic syndrome, the whole story that we now know what that is about blood sugar and insulin and how it all fits together. It's lifestyle.
Yeah.
So he changed his diet and he walked around the track, and I taught him to meditate and do yoga. And he lost his weight and his blood pressure came down and his blood sugar stabilized, and he was on a couple supplements. And I said, oh boy, this being a naturopath is the easiest thing in the world. And then 6 months later, he came back to the clinic the same way we started. Mm. And I had to ask myself a question. Paul, what'd you miss? You prescribed all the right diets and all the right supplements. You engaged him in a relationship. You listened to him. You walked around the track with him. You helped him change his lifestyle. It all worked. He went on his way and he came back 6 months later exactly the same. Mm. What didn't you talk about? I didn't engage him more fully to understand how he came to be that way. What was the core of not how do I help him lose weight, but where'd the weight come from initially, right? And that's the beginning of biography and biology and narrative medicine. And then we now know, we don't have time to talk about it in this interview, about ACEs, adverse childhood events, our understanding about the effect of childhood trauma on health and disease. Books like Scared Sick, The Body Keeps the Score, The Body Remembers, the impact of early childhood trauma on health and disease, the hidden epidemic. We now know our culture is filled with the stress and trauma of abuse and sexual abuse, not to mention a whole host of other challenges that we have as a culture. I'm not going to give you all of those statistics, but understanding your biography is critical to healing. And then I had another case when I first went into practice. Yes, go ahead.
Before you go on, I want you to, because you kind of jumped over this, but I feel like this is a really important point. This whole idea of your biography becomes your biology.
Yes.
Can you say a little more about that? Because that's so important.
This is in terms of what we now call narrative medicine. The importance to tell your story, to know where you came from. It's like E.T. has to go home. There's a wonderful book by an acupuncturist. I think her name is Kat Duff. All sickness is homesickness. Okay. And I add to that, all healing is self-healing, the journey home to your true self. That our illness, our pain is our teacher, and our illness is an opportunity. We have to diagnose it, we have to treat it. And so I ask my patients, disease tells a story not just of your cells and your diagnosis, but also of yourself and your life. And while we need to have the medical doctors and the experts and the specialists find out how to treat the heart and the gastroenterological system and the dermatological system, and we need the functional doctors to do the nutrition, and we need the naturopaths to check out your microbiome and to heal your leaky gut, and all of that is important. But Where's the patient engaging in the deeper connection that they are healing themselves with all of that? And that, two stories quickly.
Will you put your mic back up to your?
I'm sorry.
Yeah, oh, there you go.
How you doing? Okay.
Beautiful.
Did you get the other one? The other
Yeah, I
stuff?
was just a little quiet. I just didn't want to miss anything.
Two stories to tell really quickly. Another patient came to me with obesity. Again, a long story short. She had been on every diet. This is not unusual. It's a 90% recidivism rate. They lose it and gain it. That's how those businesses stay in business. Nutrisystem, Jenny Craig, Diet Center, Weight Watchers, following Oprah. I'm not judging. I'm not blaming. I'm saying with compassion, the struggle. It's not easy. Whether it's clinically, physiologically, pathologically, metabolically, psychologically, spiritually, weight loss is a lot more than what your diet is. Because if it wasn't more than that, then people would be losing, and not those businesses, they'd go out of business. They wouldn't fail 90% of the time, and somebody would have to do something else. Then they end up in our offices, your office, my office, and the patient says, I need to lose weight because my blood pressure is out of control, my blood sugar is out of control, my diabetes is out of control, my back is hurting me, my digestion, right? I'm sick and tired and blah, blah, blah. We could, again, share a lot of stories. But this one in particular, I said, Mrs. Jones, so how do you feel? Why do you want to lose weight? Just wanted to ask that question. Of course, it's obvious you want to lose weight, and it's not good for you. You don't feel good. And she gave an answer that was interesting. She said, because I'm fat and ugly and I hate myself. Mm. And I said, well, I can give you a better diet. I'm a naturopath. I'm not my specialty. But, you know, I know about your metabolism. We can individualize and we can customize and we look for allergies and we can explore other aspects of your digestion and your lifestyle and supplements and your thyroid. And we can kind of do a little bit better job. I'm not negating any of those other programs. But, you know, we're naturopaths. We're trained to do that. And we should do that. Mm-hmm. But I also want to say that I'm not going to give you a diet and try to help you lose weight until we can say that you want to lose weight because you love yourself. Mm. Now, that's a different intention.
Yeah, that's literally the opposite.
Now, you could give somebody the right diet like I did my first patient to lose the weight, and it will work. And then 6 months later, if you don't address the consciousness, it may come back because you clear it up here and it comes back someplace else, or we move the pain if we don't get to the heart of it and understand what it's about. Mm-hmm. And I had been studying guided imagery at the time with Marty Rossman at the Imagery Institute, so I'll recommend him as one of my mentors, as well as Jack Kornfield in mindfulness meditation, and Joel Wenwood and all of his work in unconditional presence, and Dick Schwartz in internal family systems therapy, and Swami Vishnu Devananda, Complete Illustrated Book of Yoga. So I'm here for all of them and our naturopathic ancestors, all of which I've integrated. Mm-hmm. And I said to Mrs. Jones, are you willing to listen with the ears of your heart to the other voices of yourself speaking? Maybe you're fat that you've been trying to get rid of, that you've been hating and gotten rid of 10 times, lost 100 pounds over 20 years, but gained it back 20 times, and you've tried this and that and did what Oprah did and did that, but you gained it back. Don't we want to heal it at some point? And at some point that becomes the addiction and the neuroses, and I'm not going to give you another diet, even though you do need to change what you eat, etc. Are you willing to listen? That's my second question. Tell me your story, and are you willing? And she was willing to listen to the fact. Mm-hmm. And an image of a down comforter came. And instantaneously she began weeping on the table because she gained the insight that her fat was her friend. It was protecting her. It was serving a purpose. Mm-hmm. It wasn't healthy in the long run, but it was survival from sexual abuse as a child. Sure. And as long as that wounded child was in there, it needed to be protected and made safe by the weight, which had corresponding physiology associated with it, metabolism with it, psychology with it, cognitive, behavioral things, rather than just, okay, here's a diet to help you lose weight. Well, the body can do that, but it's not just the body. And she wept on the table and recognized that she had a wounded little girl inside that felt scared and helpless and needed love. And that became part of the healing process, in addition to what's a healthy diet and what's your metabolism and Do you need the endocrinologist because of your thyroid and whatever the factors may be affecting her metabolism or her digestion and her leaky gut and her microbiome, and all of that is relevant and part of it, but so is her consciousness.
Yeah.
And Carl Jung said two things that are important, actually three. He said, all neuroses is a substitute for legitimate suffering. Our addictions, our compulsions, our identities, our struggle that we are in to try to free ourselves is actually just a messenger from parts of us that feel helpless and have legitimate suffering that needs to be open to and faced. I come back to my father, metaphorically. My work is, I don't want you to bypass that. I want you to face that. My dad's been dead since 1974. And I still, with passion, believe that had he seen not me, but somebody like me saying, hey, Marty, Mr. Epstein, let's go deeper. Let's try to be with this pain and trauma of the war with love, with compassion. Let's listen to it. Let's teach you to heal that work of that pain. This is the context of the liberating experience of facing painful truth. This is the paradox of our work, that the healing may be not to get rid of that fat or that pain, but to embrace it. That's a challenge, because very few people come to you as a clinician or a therapist or a meditation teacher or a mentor saying, you know, help me heal myself. They all say, you know, help me not be who I am. Help me get out of here.
Change this, fix this, yeah.
And Carl Jung said two things. He said, in addition to those, you're not what happened to you, you're what you choose to become. And this is another important point, because the third question in the self-care issue of self-healing, self-care is self-healing, is owning and loving yourself and knowing you have a light in you that can heal yourself. That's vis medicatrix naturae, the healing power of nature. That's the bodhicitta, the loving, compassionate self that Buddhists and meditation teach, and the Buddha speaks about. And Pema Trojan talks about bodhicitta, the awakened heart of compassion that can hold that pain. So my third question after how'd you come to be this way, and are you willing to listen, is not what do I do, is how do I be with it? How do I love it? I know you have a wonderful child, Jackson. When he's hurting, what does he want? He doesn't want mom to take it away, but mom wants to take it away. But before she does that, she says, come into my arms. Let me just hold you. Let me show you how safe it's okay. From there, we can decide how to be with it and what to do about it. And I say we've talked about this in our mentoring relationship, to say who you are is as important as what you know. And how you be is as important as what you do. Love heals. So as a practitioner, I know that as much as I want to know what herb to prescribe and what treatment to do and what technique to use, and I've studied that for 40 years, and it's important, I also know for the wounded little girl inside that's scared and helpless, including mine as a wounded healer and yours, what we need is somebody who sits there with us unconditionally loving and accepting, saying, I see you, I hear you, and I'm here with you, and it's okay, it's safe, and I connect with you. Then whatever therapy you may need to do will be 100 times more effective, because we know now that that's the most powerful therapy. Right. Is the relationship. And when we bring that to medicine, and self-care is your relationship with yourself. I want to eat a healthy diet because I love myself, not because I don't want to be fat. It's a different energy. Right. And a lot of the self-improvement work starts from you're not okay the way you are. As a meditation teacher, say, no, meditation is being in the moment with things as they are, not wanting your mind to be as it is, which is judging it and pushing it away. It's the opposite. It's okay just the way it is. In fact, that's what mindfulness is seeing how much you're trying to fix it. So there's a quote, I'll abbreviate it, from Krishnamurti, which is, it's the truth that liberates, not your effort to be free. And when the truth from a mind-body standpoint is a deeper pain of a scared little boy like me from the trauma of my father, not blaming him, but just understanding it.
Yeah.
right? In terms of that. And that, nobody came up to me when I was growing up and said, hey, Paul, so that you don't struggle later in life, you need to understand your dad is going through a hard time here because he's suffering from the trauma of war and we don't have any easy answers. And he's scared for this reason. And he has all this terror and he has nightmares and flashbacks and all of that. I grew up holding my ears from my dad's nightmares, screaming and not even knowing what it's about and being petrified.
Sure.
I mean, and nobody ever saying, and I say to my patients, you could be 30, 40, 50, and we can treat it with this and that. But if there's a little part of you, a little boy or girl that's still holding, conditioned by that trauma or that experience, and I wasn't there when you were 5 years old and mom and dad were screaming at each other because dad came home drunk and hit mom or whatever the trauma may be. And I asked people to write their bio for me and contained, and you know this, we've been working on this together. Oh my God, just telling me your story sets up the entire process of healing. It's like right there, you don't even have to make the connection. The patient makes the connection. And then their self-care is coming from self-love and compassion. And we must have the compassion because this is the human condition. The human condition is there's pain, there's suffering. And the good news is that there are therapies, and all of them are good, like Hakomi therapy and Gestalt therapy and focusing therapy and process-oriented therapy and internal family systems therapy. And I just trained in diabolical behavioral therapy, DBT, and it's all the same stuff. It's all mindfulness and love. It's all presence. It's all connection.
So
So that's my work, is how to help people connect with themselves and give them the choices and tools they need to connect with themselves with calm, with clarity, with compassion, with courage, with creativity, with patience, with non-judgment, with acceptance. And you teach what you need to learn. We can cultivate these things. I'm healing myself talking to you about this in a sense of reminding myself again. Be gentle, Paul. Be patient. Don't judge. Accept. Let it be.
well,
Be loving.
can you speak a little bit, because I think a lot of us go to really great lengths to avoid feeling into those feelings of discomfort. We numb out, we distract, we keep busy, we
Yes.
refuse to go there. We put a tremendous amount of energy into avoiding, resisting, running, whatever.
You got it.
I think because we're scared that we're going to be overwhelmed or that we're going to
Yes.
get depressed or that we're not going to be able to function in our world.
Yes.
Can you talk to us a little bit about, is there truth in that? How do we get over that
Of
fear?
course there's truth in that. Well, how we get over that is recognizing that we can't, like in 12-step recovery, there's a saying, only I can do it, only you can do it, but you can't do it alone. That's why I'm training doctors and therapists. I did a program at Omega Institute for both medical doctors came and therapists came, therapists to understand mind body more, doctors to understand emotions more. And it's to recognize that that's our presence, to create that safe place, to do our work clinically, whether we use drugs or surgery or whatever treatments, naturopathically, Chinese medicine, herbal medicine, nutritional medicine, functional medicine, it doesn't matter. But at the same time, we integrate that patient may be touching a deep wound as a underlying context for their disease, that we have to find a way to open to that and at least open the door and then pass them on. Like a patient comes to me with severe chest pain, I will be their doctor, but send them to the cardiologist.
Yeah.
So I'm training people to open the door to live these questions. In the process of living these questions, you're developing a relationship of connection and trust to go deeper. And then the patient themselves start to understand, gently put the toe in the water. But here's a line that I think is really important. We have faith. I have faith in Vistan and Acatrix. I know the healing is within the patient. So my trying to fix them won't get them anywhere as much as my codependent wounded healer in me needs to fix them.
Right.
I'm training myself not to trust that. That's number one.
Yeah.
I also trust through my practice of Buddhism and Buddhist psychology and mindfulness and meditation and compassion that the bodhicitta is real. That if I get out of the way, that the patient has within them the power to be with that pain.
So what is a bodhicitta for those of us?
The heart of compassion that will allow it to breathe it in, welcome it instead of resist it, instead of run from it and avoid it. That's what's meant by the truth liberates, not your effort to be free.
Well, and I think it needs to be stated that most likely if you're having chest pain and you go to your cardiologist, that cardiologist is not going to refer you to therapy or to a mind-body practitioner. But if you, as the person who's having the symptoms, are willing to listen to the expression of your body, then hopefully after listening to this talk, you'll realize that your symptoms are your guide back to yourself. And then it's not about seeking out a Western medical doctor or a naturopathic doctor or an energy healer or whatever to make it go away.
Yes.
That's actually an invitation to go deeper into yourself.
Yes. Yes. And that's the process of these questions. Tell me your story. Let's listen to it together with imagery and mindfulness, and let's be with it.
Yeah.
Let's be with it with compassion.
Yeah.
Let's open our hearts to it. Let's allow ourselves to be present with it in that way.
Yeah.
And in that context, we face this wound. But here's the third piece that I think is really important. You and I, as wounded healers, we've survived it with no help. So with help, we can heal it. In other words, that patient came to me and they came from this situation and that, and they have this trauma and that, and here they are, they made it. They've gotten through the worst. Now they have choices, they have resources, they have support, they have understanding, they have themselves, they have a doctor, they have a therapist to help them. So that allows me to say, to have the courage to go there with them. Yeah. That patient I told you about who felt scared and helpless and needed love and said, I'm fat and ugly. I was very frightened at that moment of like, oh my God, I hadn't had that much experience opening that door for people. And it's easy to say, go see a therapist, but when you're the one that's opening the door, you want to be present there. Yeah. And what I learned is every step of the way, you midwife people, that what's needed is your presence, making sure that they have what they need. And what I have found is if you're gentle with this, it's not hitting somebody over with a sledgehammer. If you create the space and you live the questions and you create the safe environment, the voices that need to speak will speak. Yeah. And the parts of them that need to listen will listen. And together, the relationship is one of relationship-centered care. Right. And really, that's what we're talking about in self-care medicine. It's your relationship with yourself, but it's a loving relationship. And it's recognizing that there's parts of me that need a healthier diet and need to take a walk and need to meditate, need to take supplements and need to get healthy and do all of these wonderful self-care things. But what's our intention? Our intention isn't to fix ourselves or cure ourselves or even heal ourselves. Our intention is to listen to ourselves, which is the basic wound that, I just wanted somebody coming back to my story. If when I'm growing up, somebody said, does anybody see what's going on with that? Somebody tell me I'm not crazy, but nobody talked about it. If somebody would just have listened and said, hey, Paul, tell me what's going on. You must be having a hard time with your dad, but nobody did that. And I asked my patients, did somebody talk to you about your father's alcoholism when you were 5 years old? No, I've never talked about it. Well, now we're going to talk about it. Yeah. And you've survived it. But we now want to heal it. So we're going from surviving to healing to thriving. But that process, like the recovery process, it's really not different. Meaning, the alcoholic that goes to a meeting, he's experiencing the liberating experience of facing painful truth. Because he's willing to face what's there, because he's hit bottom. He knows that I have a choice to keep drinking, and that's more suffering, even though each drink seemingly takes me out of my pain for the moment. Or I can stop. The shit may hit the fan. I may have to start feeling that which I'm avoiding. if someone like you or me is there present with our patients and saying, it's okay. I know part of you wants to run away, but we can stay here. It's okay. You'll get through it. You can cultivate resilience. I just spoke for the California Association, a whole talk. I'll probably share it with people who send in wanting handouts from me and wanting links to talks that I've given. And I did one in particular, a couple on resilience because of what California went through with the fires.
Mm-hmm.
And how you respond to that, you cultivate the courage, the compassion, the calm, that it's not what's happening, it's how you choose to deal with it that will determine what's going on. I learned firsthand in our studies about stress and how you respond to it.
Yeah.
So the number one stress is the death of a spouse. And if you don't grieve, you'll be in the doctor's office a year later with arthritis or asthma or depression. If you grieve, it's going to hurt. You've lost a loved one. It's going to be painful for the rest of your life.
Yeah.
But it can be painful in a healing way.
Yeah. Yeah.
Not in a split off way.
Yeah.
And not in a push away way. And that's the ultimate challenge and paradox for us as wounded healers, using that phrase, because we so much can connect with the pain of our patients, and we so much do care with compassion and wanting to help them. And the challenge is, how do we use that in a way that lets them heal themselves, not just give them what they need to fix themselves and cure themselves in the right way, like another diet, but take them away from the opportunity to face that deeper issue. Because that's where the healing is.
Well, and as our health situations get more complex and our medical interventions gets more complex, I think we really undervalue the healing power of presence. Just being with ourselves and being with that pain and being with these parts. I mean, I do this all the time with my patients and myself, is when we get to it and listen, there's like really deep insight and wisdom and healing. You're just watching someone's face change in an hour session, and it doesn't have to be long and drawn out and complicated. You know, we can rehash old wounds, and that can be therapeutic in and of itself. But sometimes, really, like we started out with, you know, there's a big difference between intellectual approaches and heart-centered, presence-based sitting with, I'm willing to be with all that's here unconditionally, and how deeply healing that in and of itself is.
Yes. Yeah. That's the healing power of unconditional presence. And that is medicine. Now that when we talk about healing, we can say, as doctors, as therapists, as mind-body doctors, as naturopathic physicians, that what you just said is medicine. It changes the brain, the immune system, and the genes at the cellular level. Yeah. When you change how you look at it and you change how you be with it, it changes. If you can appreciate that when you see that glass half full or half empty, that how you choose to see it will determine what's happening in your body. When you have cancer and you spend the rest of your time worrying in fear that you're going to die, that creates a certain biology in your system. Yeah. When you have cancer and you see it as a challenge and an opportunity to heal yourself in spite of the fear and the pain and to face it, that change is a different shift that can change what's happening in the mind and body. We understand that now. So this self-care is medicine. It's just coming to me now, an interesting sidelight. You know, you've heard about Sounds True. Anybody who's listening to summits are of how we spread information and share with the public, which is exciting and wonderful. And Sounds True just did a great one on the brain and neurology, okay? And in that context of the brain and neurology, they had these two medical doctors talk about Alzheimer's and preventing Alzheimer's. And what was amazing was, this is 40 years after Health Styles, they spoke as if they had discovered fire, because they said the most important thing that you can do to treat and prevent Alzheimer's is lead a healthy lifestyle. They talked about diet, exercise, and stress. And the doctor who was interviewing, oh, that's amazing that doctors are telling you that that's the medicine, because we haven't found the magic cure or the magic pill for Alzheimer's. The magic cure and the magic pill for Alzheimer's and heart disease and cancer and diabetes is what we're talking about. And in addition to that is the deeper core of the opportunity, not to get too corny, but the world needs now is love. Love is the medicine. Self-love, self-care, self-medicine, and connecting with compassion to others. In my work, as you know, in addition to all the therapies of mind body, what you shared, and I'll say this, which is wonderful, knowing that your being and your presence and you're listening to your patients and opening them to that pain in a loving way, in addition to everything else that you might choose to do clinically to treat, is the medicine. Having been in practice now for 35 years, I will ask people, patients I've had over the years, who I know have been helped by our work together. And I have no magic, and it's a lot of what we're talking about. And I've asked them, just share with me, how did I help you if I've helped you? What did you take away from our work together? And they're ongoing cases. And they don't tell me what therapy I did, whether I did IFS or I taught them yoga or I taught them mindfulness or I gave them the right diet or whatever we do as naturopaths treating the whole person. They all said the same thing. You gave me the confidence, the trust, the sense of competence that no matter what I have to face in life, an issue, a pain, a grief, a stress, a trauma, my house burned down, my loved one dies, I get diagnosed with X or Y, I can face it. I have the resources. I have the choice. I have the strength. I have the compassion. I have the courage that I can roll up my sleeves and come to terms with it. And I know that that's the medicine. And I have that. And you've given that to me. So I hear that in a loving way. It's nice to hear when you tell me how your presence with your patients, you see what happens. Yes, you're giving them the space to heal themselves. And you can prescribe an herb too.
Sure.
And a diet, but you're connecting them with that deeper pain and that deeper wound. And that's what we want. That's the medicine. That's the prevention and the treatment at the same time.
Can you talk briefly about self-care and self-love versus self-improvement? Because I think this is a subtle yet incredibly important part that we've kind of touched on, this whole idea of fixing, but I really want to make sure we're honing in on it before we go into a meditation.
I think it's subtle, and I think it's important to have a particular orientation of intention before you do that work. Coming back to that patient I mentioned who says, I need to lose weight, I'm fat and ugly and I hate myself. Well, here's the diet, but can you go on that diet because you love yourself instead of because you hate yourself? And what's the difference there?
Right.
So how we might do that is say, I love myself the way I am, and I still need to grow. I have been diagnosed with cancer and I'm scared to death, but it's okay and I can work to heal myself. An example of that is a patient I had when I was in Israel it's coming to my mind now, was a colonel in the Israeli Air Force. You don't get afraid unless you get diagnosed with stage 4 cancer. Then you're scared. And you're not allowed to be scared, and you don't know how to be scared. So then he comes to me because his doctor says it's not good to be scared. But the doctor just told me I'm going to die. Hello.
Yeah.
So he came to me and he said, like, I'm fat and ugly, I want to lose weight. He came to me and he said, Dr. Epstein, I've been diagnosed with cancer and I'm scared to death and I don't know how to deal with my fear. Can you help me not be afraid? And I said to him, it wasn't Mr. Jones, it was Mr. Schwartz. And I said to him, I can help you be with your fear. Being afraid is appropriate. It's natural that part of you is afraid. It's a question of how are you going to be afraid? Are you going to be afraid in an obsessive way that you're going to walk around, oh my God, I have cancer, I'm going to die, and my glass is half empty? Or are you going to be afraid in a way, I've just gotten a diagnosis and part of me is very scared, but another part of me is strong and courageous and I'll do what I have to do and I'll explore ways to heal myself and I'll come to terms with it and I'll get support and I'll use this as a challenge just like everything else in life. And I already have those resources and that strength and that courage that I've been able to use as a soldier in wars. I can certainly do that to apply to a diagnosis of cancer. Yeah. So after a couple of weeks of just that approach, how do we look at it and how do we be with it. He said to me, you know, Dr. Epstein, it's really interesting. I still have cancer and I'm still afraid, but something changed.
Hmm.
I can be with that fear in a different way. It's the same as holding a grudge or resentment against somebody and being willing to practice forgiveness as a process to let go. In that intention to be forgiving, when that patient doesn't change, but how you look at it changes. So when you change how you look at it and you change how you be with it, it changes. So the intention is to be with it with love, with compassion, instead of with fear. To see, oh my God, I've lost everything, instead of, boy, how grateful I am for what I still have. The person who's lost their home in a fire or a flood or a hurricane says, thank God we're all alive. Gratitude, they're going to get through it. They're thankful for what they have. The other person lost the same thing. I'm not judging, but they're going to go, oh my God, I lost this, we'll never recover.
Yeah.
The same situation, one person is going to get through with resilience and the other person is going to struggle and perhaps even get ill from the stress and the trauma. It's how we choose to face it. And I think that's something in the self-care realm. There's no limit to what you and I can help a patient with, nutritionally, herbally, dietarily, lifestyle, consciousness. It's not what we do. I had a patient the other day, I don't want to divulge, but it could be any patient. And they were engaged in self-care and called me. It was a new patient. And on their own, they were working on tapping, and they were working on meditation, and they were working on imagery, and they were working on Eckhart Tolle and the power of now, and they were working on self-directed neuroplasticity and Rick Hansen. All fantastic, fantastic therapies that I would recommend to anybody and to the audience. Yeah, listen to Eckhart Tolle, listen to Jack Kornfield and Joseph Goldstein and John Kabat-Zinn, and listen to IFS and self-energy, and listen to Nicola, Dr. Nicola, etc. But also ask yourself, what's my intention? Is it to fix myself because I'm broken? Or is it to heal myself because I'm loving myself? And what heals is wholeness. And what heals is touching the wound of the truth, not trying to get past it, get around it, or get over it. So that's a very subtle difference. But one sells magazines. And even the Mindful magazine, you know, even in meditation, you know, here's what works. That's why, is it going to work? You don't meditate to make it work. You meditate to be in the moment, and be in the moment is what makes it work.
That allows it to work. Yeah.
That allows it to work. And so that's the challenge we all have, myself included. You know, one of the things I could share this with you in my passion, in my understanding of how do I help people heal in my own woundedness. And I got very, very, very good at taking the patient from whatever their symptom disease was to go right very quickly right to the core of where the healing is. I was asking that, where's the healing? Oh, this is the truth. Oh, this is what this is really about. I'm not saying don't get this test and don't take this pill and don't acknowledge and treat the diagnosis. We treat the disease and the biography, right? Mm-hmm. We treat both. Okay? And in my passion, I could get right to there immediately, almost. Especially if they write their bio. Oh, it's obvious. You have all this pain from your childhood. Yeah. Let's roll up our sleeves and get there. And guess what would happen? This was years, a patient wouldn't come back.
Right.
I go, wait a minute. They've been suffering for years. I helped them find the deeper truth of what it's about.
Yeah.
So we have to tread lightly. Yeah. We have to be gentle. We have to recognize again that underneath is we're scared and helpless and need love. And we've constructed an identity and addictions and approaches specifically to protect ourselves from it. This is part of IFS modality of protectors and firefighters when we get scared and we're going to touch that wound to act out. But we have this wise self. And once I get out of the way and I stop trying to get to that place for the patient, but help guide the patient to find that place in themselves, my woundedness gets out of the way to fix them. And now I'm just guiding them home to themselves to see their own truth.
Okay.
And then they're willing to do that because I'm getting out of the way to fix them. I'm not feeding my need to fix them, and I'm not feeding their need to get fixed by
Mm-hmm.
going to the doctor and give me the right treatment.
Yeah. Yeah.
Now we're in a partnership of love and trust. And in the midst of that, we can prescribe a drug if needed. We can prescribe a therapy if needed. We can prescribe herbs and vitamins and remedies.
But it's coming from a
But
different place.
it's coming from a context that's creating space for the vis, for the healing, for the patient to be engaged consciously in their own process, because all healing is self-healing.
Mm-hmm.
And all self-care is self-healing when done because of love. So I want to change because I love myself. And I welcome this pain, this scared little boy and girl in. Finally, for the first time, I see you. It's okay. I don't want to get rid of you.
You're welcome.
And don't worry, we'll heal it. We'll lose the weight and in time. But first, let's learn to love ourselves. Let's learn to be gentle with ourselves.
Yeah.
Let's learn to be compassionate with each other. Then I think integrating this piece in the healing soup becomes an important context. Let me end this with a story about my mom, and then maybe do a brief meditation
Okay.
and a reading.
Great.
Or any other comments, questions you have. Let me honor my mom too, in the sense of she passed away. My dad died suddenly of heart disease on the operating table, having bypass. So that's pretty much what I'm talking about. Don't bypass it, love it, the pain. My mom died slowly from Alzheimer's at the age of 90. So I had time to reflect and time to engage in healing, and it was painful but beautiful to be present with her dying, as it were. And before she passed away, my sister and I have one older sister. We got her recipe for chicken soup. You know, all of the books on chicken soup for the soul and chicken soup for this. Well, it's true. Chicken soup is medicine. So it was times of beauty and family love when we would get together and have chicken soup every Friday night and light Sabbath candles, and in the midst of the chaos of a dysfunctional family and the craziness that we all go through. As an aside, there's a codependent joke book, which has a big diagram of, you ready? A big diagram of Yankee Stadium and the convention, Adult Children of Functional Family Convention. It's empty. There's one person in the whole stadium. So that's just to know that we're all on the same boat. Back to my mom. We got the recipe for her chicken soup. We did it perfectly, my sister and I. The vegetables, the chicken, where we got it, when we put it in, how we cut it. We had like a whole, 20-page recipe, right? And even though she had passed away, she was still in her home telling us what to do. And without guilt, hopefully we were doing it right. We cooked this soup with as much love as you could cook soup, and attention and mindfulness. And it was delicious soup, but it wasn't my mother's chicken soup. Because my mother wasn't in the soup. Only she can cook her soup. So I tell that to my patients, and I tell that to my doctors who are treating their patients that I'm mentoring. You can put a zillion things in their soup and it's the right stuff, but if you don't help the patient get into their own soup, to own their own healing, to participate in it. And yes, self-care is eat this and eat right, but if that self-care must come out of the patient's full engagement and consciousness and welcoming of that, so they're in that soup, because that's the most important ingredient in the soup, which again, coming full circle, is why I'm really excited that you put on this summit. Because self-care as medicine, self-care as really deep healing, when done in this way of self-love and self-compassion. Yes, eat healthier. Yes, avoid gluten if you have to. Yes, take a walk every day. Yes, practice forgiveness and mindfulness and the power of now. But let's do it because we love ourselves and we start from a sense of wholeness, not because we're broken and we need to do it to fix ourselves, because that reinforces it.
Yeah.
So if I can, I'd like to guide people in a brief meditation.
Would be great.
And I know that some of the things on the summit, there's a way that they can contact me and get on a list and get sent some handouts and some links to some talks I gave on resilience and a deep meditation I did on healing presence, the exact topic you said. But I'd like to, if I could, before I do the meditation, for very brief, I gave a talk last night at a happiness club.
Oh, cool.
And I said, you know, I wrote a book on happiness through meditation. And the reason I wrote this book is because all I talk about is pain all the time and healing pain. So I wanted to write that really, I want to help you be happy. Yeah. I'm not, you know, but sometimes we have to do that. So I found this quote by Pema Chodron, who talks lovingly. There's a great thing, and I'll share with you, when you said initially about how do you get unstuck from your patterns, which is another deep question about all neurosis is a substitute for legitimate suffering. And Jung also said, we don't get enlightened by imagining the figures of light, but by making the darkness conscious. And Pema Chodron has a great program called Getting Unstuck. And it's basically stop the behavior, don't scratch it. Don't, you know, and then you'll feel the uncomfortable, but that's how you break the pattern. But this is something that she wrote that I want to share with you. Okay. Life is glorious, but life is also wretched. It is both. Appreciating the gloriousness inspires us, encourages us, cheers us up, gives us a bigger perspective, energizes us. We feel connected. But if that's all that's happening, we can get arrogant and start to look down on others. And there's a sense of making ourselves a big deal and being really serious about it, wanting it to be like that forever. Look at me, I've achieved enlightenment and I've healed myself and look at my self-care. The gloriousness becomes tinged by craving and addiction. It's like we get attached to it in some way. On the other hand, wretchedness, life's painful aspect, softens us up considerably. Knowing pain is a very important ingredient of being there for another person. The wounded healer, knowing our own pain, as Jung speaks about. When you are feeling a lot of grief, you can look right into somebody's eyes because you feel you haven't gotten anything to lose. You're just there. You can relate. You can connect. You can feel their pain without needing to run from it or take it away. The wretchedness humbles us and softens us. And if we're only wretched, we would all just go down the tubes. We'd get depressed and life sucks and get me the hell out of here. That's me. We'd be so depressed, discouraged, and hopeless that we wouldn't have enough energy to eat an apple. Gloriousness and wretchedness need each other. One inspires us, the other softens us. They go together. That was Pema Chodron. Start where you are, a guide to compassionate living. So let's do our self-care by acknowledging the truth of our pain and our struggle and welcoming it and let it soften us and make us tender. So it's not just for us, so we're connecting. We're connecting. And maybe our patients and ourselves, those wounds, what they really want is that connection, is that safety and that connection. Somebody just say, I see you, I hear you, I care. Not, you're broken, how can I fix you?
Well, and that we're doing that for ourselves. Because I think a lot of times we want other people to see us and tell us that we're worthy. And that feels nice for 5 minutes or a couple of hours, but then we're looking for the next hit, you know, and so when it's coming from your own internal well, then we're on to something. Then that's
all healing is self-healing. The first thing we learned in naturopathic school, vis medicatrix natura, healing comes from within. Give people what they need to heal themselves.
I want to make sure we have time for the meditation. Do you want to go ahead and lead us?
Yes, let me give a meditation now, okay? Great. I'll do a brief sort of mindfulness, compassion meditation.
Great.
Of self-love and self-acceptance. I also want to recommend the work of Tara Brach and a wonderful book that she wrote called Radical Acceptance, and she's got wonderful talks online, stuff on Sounds True. I mean, the internet is unbelievable these days with, you know, a whole education of healing that's available, and everybody's coming to the same truth in that way. So close your eyes, Take a breath. Come into the present moment. Be here now. By the way, that's where life is happening. That's where love happens, that where healing happens. An exercise I do with myself that I want to share with you that supports me to be here now. I ask myself, where am I? And I always say, you're right here. And I say, what time is it? It's now. And then I ask, Paul, what are you doing? You're just being. And every time I ask that question, the answer is the same. Be here now. Amazing. You can't get simpler because that's always where you are. Except if you're not there, you can't experience the benefits of being there. It's so crazy. So let's open our hearts. That bodhicitta, that bodhi teacher of love and awakening and compassion. Let's open our hearts to the gloriousness of life, the beauty of life, even in the midst of suffering and struggle. I mean, that's, one thing Jack Kornfield, my teacher, would say all the time. If you get born with a body, it's going to ache sometimes. You get born with a mind, you're going to get anxious and worried. You're going to get born with a heart, you're going to break. That's what happens. It's not happening to you. It's not your pain. It's the pain. Bringing in the teachings of the Buddha, the truth of suffering, and the path to end suffering, and to be on that path. And it's a path of love and awakening and passion. So open your heart to that place in you that is loving and compassionate. Think of someone in your life for whom your heart is open and you care and you just hold them with presence. Your child, your friend, your mate, your parent, your grandparent, your teacher, your guru, your God, for whom love is natural, for whom your heart naturally opens to receive them. And breathe them in to your heart, into the now. Be here now, into this heart of compassion. And in the context of self-care as medicine, imagine all the ways you take care of yourself and all the ways you can do a better job taking care of yourself. And imagine choosing to do that with a loving, compassionate heart. I want to get better and happier and healthier because I love myself, because I deserve love, because the parts of me that may carry some pains and wounds are saying, please see me, please hear me, please listen to me, please love me. Please give me space. Please hold me in your heart of compassion. Please connect with me. So do that now. Breathe in your struggles. Welcome them. Breathe in whatever darkness and challenges may be there into this heart of compassion that's capable of holding it with love and presence and compassion. And just the intention, I love myself the way I am. And the way I am is human like everybody else. And I'm not perfect. And I have wounds. And I have struggles. And I've made mistakes. And I have pain in different parts. And I'm okay just the way I am right now. And I'm going to be and do whatever I can to be happier and healthy, but I'm going to do it with love. I'm going to do it with acceptance. I'm going to do it with compassion. I'm going to do it being who I am in all of my gloriousness and all at times of my wretchedness, as Pema Chodron says. In all of my darkness and all of my light. The heart of healing. Self-care as self-healing. Self-care as self-love. And self-care as self-healing and self-love, not just for ourselves, but for our families, our loved ones, our communities, our planet. That's who we can dedicate our work to, our life to, our love to, our self-care to, for the benefit of others, for the connection, for feeling that connection. It is our own suffering that is the connecting piece that lets us know we're human, that lets us connect with others who struggle, and lets us connect with ourselves. So breathe that in. Breathe that in. Breathe that in. And a final quote from Krishnamurti. It is said that in difficult times, it is only bodhicitta that heals. When inspiration has become hidden, when we feel ready to give up, this is the time when healing can be found in the tenderness of pain itself. This is the time to touch the genuine heart of bodhicitta. In the midst of loneliness, in the midst of fear, in the middle of feeling misunderstood and rejected, is the heartbeat of all things, the genuine heart of sadness. Just as a jewel that has been buried in the earth for 1,000,000 years is not discolored or harmed, in the same way this noble heart is not affected by all our kicking and screaming. The jewel can be brought out into the light at any time, and it will glow as brilliantly as if nothing had ever happened. No matter how committed we are to unkindness, selfishness, or greed, the genuine heart of bodhicitta cannot be lost. It is here in all that lives, never marred and completely whole. Bodhicitta is who you are. It is who we are. And let us live our life from that awakened heart of compassion.
Whew, that was beautiful. Thank you so much. Well, I don't want to say too much more as to let you kind of float away in that space that you just created. So thank you so much for bringing all that you are and all that you be to us today. We will be sure to make sure that if this was compelling to you like it was to me, that you can stay in touch with Dr. Epstein and learn more from him, because believe you me, there's a lot more. We just started scratching the surface today. And he does have that book, Happiness Through Meditation, and I think that's on Amazon too. So we'll make sure that you can connect with Dr. Epstein if you want. And I'd like to finish with a quote from his book, which I love. As we are present in our lives and conscious of our power to choose how to be, we cultivate greater happiness in everyday life. And if that's not the point, I don't know what is.
So thank you. Been great to be here with you and get me excited and passionate to share what I've learned, and what I've learned mostly from other people who've had the courage to look inside and love themselves by facing the challenges that they have. So it was great to be with you, and thank you everybody for listening, and I look forward to hearing from you. We'll be sending you whatever, I think a lot of handouts and some links and some talks that may be helpful for you on your journey. I wish everyone well, and thanks a lot, Nicola. It was great to be with you.
Yeah, thanks so much. I really, really appreciate it. Okay, we'll talk to you all again soon. Bye.
Bye.